This building is truly a beautiful facility, but it's also much more than a state-of-the-art structure. The new home of our Children's Hospital is a building that embodies and fulfills our commitment to family and patient-centered care. It's now my great pleasure to introduce the President of Penn State, Dr. Rodney Erickson.
It was exactly 3 years ago today that many of you came together to celebrate the groundbreaking of the Penn State Hershey Children's Hospital. It was a circus, literally. But along with Cirque du Soleil-inspired performance and the Hershey High Band came a very serious promise. On that day, the state government, private donors, patients, staff, and Penn State united as a community in an ambitious and visionary collaboration that would bring a new level of care to children and families in our region. Today, we celebrate the realization of that commitment. In fact, Penn State Hershey Children's Hospital has exceeded our greatest expectations. It is making our community better by providing exceptional medical treatment, offering comfort and care during trying times, and promoting health and wellness to last a lifetime. It is also a place to pursue clinical research, to develop cures for diseases such as cancer, and to advance personalized medicine. Today is a day to say thank you to everyone who donated their time, talents, and support to this project. That includes our medical professionals, the Penn State and Hershey communities, our business partners, patients, families, philanthropists, and countless others. In particular, I want to note Highmark's leadership in early investment in the Children's Hospital building and clinical research capabilities. We are also deeply grateful to the Pennsylvania legislators who have consistently supported this project from inception through completion. It has been a long process with many changes in Harrisburg, but state government has stood with us as we pressed on to completion. I also want to recognize Ed and Jeannie Arnold for their exceptional leadership and generosity of their time and time. They have been tireless in their efforts to help children and families, and we owe them our deepest gratitude. Finally, I wish to say a few words about Thon and the students who make it happen. Since 1977, Thon has raised more than $89 million for the Four Diamonds Fund at Penn State Milton Hershey Children's Hospital. Thon contributed $10 million to create a new pediatric cancer pavilion here at the Children's Hospital, and beyond that, Thon has given much, much more. I often think of the Four Diamonds children and families who come to University Park for our Thon weekend in February. Some of these children are frail, having lost their hair and some of their strength, but they haven't lost their spirit. Invariably, these little ones keep the Penn State dancers going with their enthusiasm and their passion for water gun fights, singing and dancing on stage, and offering hugs to tired students. I'm inspired by their exuberance, their endurance, their courage, and their confidence in their doctors and nurses. The relationship between patients and medical professionals is a true collaboration. Collaboration is also an apt description of the research conducted here and on the University Park campus. Researchers and clinicians at Hershey are active collaborators with students, faculty, researchers at University Park and other Penn State campuses. From the life sciences to material sciences to biobehavioral health to engineering to business to law to health and human development, we're seeing interdisciplinary work that's creating new knowledge. One example is the newly established Center for the Protection of Children, based here at the Children's Hospital. Under the direction of Dr. Benjamin Levi, Professor of Pediatrics and Humanities, the center will improve the detection, treatment, and prevention of child abuse. I'm very proud of the valuable work that is being done every day at the Children's Hospital, which is ranked as one of the nation's top children's hospitals for orthopedics, diabetes care, and treatment of pediatric cancer. There's no question that our doctors are among the best in the country. We're very fortunate to have such dedicated employees, experienced medical researchers and professionals, and an extraordinary volunteer base. In order for our state and world to move forward, we need to ensure that each new generation has an opportunity to do better than the last one. Projects such as this are essential for making that possible. On behalf of Penn State, I offer my deepest appreciation to everyone who worked together to make the Penn State Hershey Children's Hospital possible. Thank you for contributing your expertise, leadership, commitment, and financial support to this project. Thank you very much.
Like countless families, our connection with the Penn State Hershey Children's Hospital is deep and personal. It began with the joy as we watched our 3 children, Claire, Will, and Gabe, take their first breath and receive their first health care here. But our connection became more profound and more acute in December of 2007, on a day that should have been like any other day. The holidays were coming and all that goes along with it. Shopping, family gatherings, tickets to see the Nutcracker. Claire was 7 years old in 2nd grade. For her, life was all about what was coming next. That is, until December 15th, when we found ourselves in the emergency room, not too far from where we are now gathered. In the midst of a massive snow and ice storm, our daughter Claire was in so much pain from what we thought was a sprained wrist that we decided to trek to the emergency room. There we thankfully met an assembled ER team that saw past Claire's wrist, and through their training and compassion, something far more concerning. Where we saw a potential sprain, they saw a very sick little girl. In a matter of hours, we were talking with a pediatric oncologist and hearing that Claire's sore wrist was not the problem, but a symptom of a much bigger challenge. After moving to the 7th floor, blood transfusions and bone marrow tests, we learned 2 days later that Claire had acute lymphoblastic leukemia, cancer. There is no way to fully describe or recount the feelings of a parent during those first few days. There's fear, frustration, anger. You need to take action. You need to know that you are doing the right thing by your child. You ask yourself one very important question. Is this the right place, the best place for my child? Kevin and I asked that question many times during those first few days. The answer unfolded with our experience. As we braced ourselves to face the challenge, we found that we could rely on the blessings and comforts we found at Penn State Hershey Children's Hospital. It was a blessing to have the medical knowledge and technology to fight pediatric cancer. It was our comfort to have it delivered by so many helping hearts and hands. It was a blessing to be able to get first-rate care and treatment in our own community. It was a comfort that the care and treatment offered here extended beyond Claire's medical needs and reached our entire family. It was a blessing to learn about 4 Diamonds and the Children's Miracle Network and other support systems that carry families through such difficult times. It was and is our comfort to know that those organizations are committed to being part of a long-term legacy here.
Today, we are cutting a ribbon on a new building, but it represents a long-standing and continuing commitment to children and their families that is time-honored at the Penn State Hershey Children's Hospital. Bricks and mortar do not provide care. People do. People like the doctors in the ER on December 15, 2007. People like Dr. Andrew Freiberg, who's in charge of Claire's care. The dedicated nurses and staff that help families on the inpatient wards and at the outpatient clinics. The music therapists, child life specialists, social workers, specialists like neurologists and surgeons, psychologists, who have all been a part of Claire's care. These people all come together to provide family-centered care, the complete and comprehensive care necessary to make your child well again, and to keep your family together and functioning under the most difficult and unimaginable circumstances. So as a family, we do not see this building as just a place to get great family-centered care for kids. We see it as the culmination of decades of experience and dedication to caring for kids and their families. It represents the millions of children and their families who have sought treatment at the Children's Hospital since its founding. It's a celebration of the success and it honors the memory of those who, despite every best effort, are no longer with us. On behalf